Hi, Brent Johnson from NJ Advanced Media here on NJ.com's Facebook page. We have New Jersey Governor Phil Murphy live to answer questions as the state continues to deal with the fallout from the coronavirus outbreak. Governor, thank you for joining us.
Good to be with you, Brent. Thanks for having me.
So really heady times in these states, and California and New York just enacted major measures to almost shut down all non-essential businesses and people working. Will New Jersey do a similar type situation? What do you have planned coming and when?
Yeah, we will, Brent. I mean, in many respects, they did something, California did something that sounded like it was a lot more significant than what we've already done. And frankly, we've probably been as aggressive as any American state, but we're going to tighten the screws further. We have no choice. That doesn't bring me any joy to say that, but we have to so-called flatten the curve here. We've got to enforce aggressively social distancing, and that's the only real weapon we have to take the pressure off the healthcare system and break the back of this virus. And so we're going to probably, my guess is by tomorrow, effective probably for tomorrow night, we're going to bunch more steps in the direction that we've already been going.
Will it basically be an order for people to stay at home? It'll be something similar like that?
To be determined, but it'll be, no gatherings, non-essential businesses, not open. It's going to be more along the lines of the journey that we've been on. Again, we've been as aggressive as any American state. The fact of the matter is, at this point, as it relates to the virus, there's no amount of aggressiveness that's too much. The economic impact, Brent, and that's a point that I want to make sure I make to your followers here, to workers, to small business in particular, is enormous with something like this. So we need the federal government to come in a big way. We just put a letter, which I led to Congress and to President Trump. We think New Jersey, New York, Pennsylvania, Connecticut alone, we need $100 billion of direct cash assistance. That's the sort of fallout we're talking about here.
What are the models that you're being shown in terms of peak cases for this? Do you know how bad this could get and how many number of cases we get?
I don't have a crisp answer for you in terms of how bad, but the numbers are going to go up, and they're going to go up meaningfully, in particular positive tests. I mean, at this point, we have a total positives of 800 and something, 155 overnight. Sadly, we had 2 more fatalities, bringing our total fatalities to 11. But a couple of things that I want to just say about the numbers to get behind them a little bit. Part of the reason, and we predicted this, and we'll continue to predict that this is where it's headed. Part of the reason why the numbers are going up dramatically, partly due to community spread in certain places. Bergen County's been hit the hardest, but it's going up as dramatically as it is mostly because we're testing a lot more people. Mm-hmm. We opened our first drive-through testing today at Bergen Community College. We tested 600 people at that site alone. The testing access is expanding dramatically, which means the numbers are going to go up dramatically. And I know that on the surface that could cause more anxiety. The fact of the matter is, the more we know, the better we'll be in terms of our ability to deal with it. Secondly, and finally, on the fatalities, I think in 9 of the 11 cases, there have been adjacent health issues, underlying health issues. That appears to be the population that is getting hit the hardest. So that's another way of saying good hygiene in terms of public health is now more than ever needed.
Do you have a sense, a lot of people see these numbers going up, but do you have a sense at all of people are getting better or recovering from this that have gotten it here?
Yeah, we've got a general sense. A lot of folks are not hospitalized, particularly those that are younger and or who don't have underlying health issues. But there are there's the folks who are getting it badly, Brent. There's no understating how bad this can be. Again, 11 fatalities and a lot of other folks hospitalized. I have a particular plea for our young people. They've got to take this seriously for 2 reasons. One is it looks like it's got a little bit more teeth in their generation than was originally thought. There was an original view that young people were sort of being unscathed. That's not true. Our youngest positive is 3 years old. But the bigger reason is, even in the overwhelming likelihood they're going to be okay, they could unwittingly pass the infection on to somebody of a higher risk part of our population, like a grandparent. So we just got to make sure everybody is staying at home and staying away from each other.
We've heard a lot about Bergen County. Are there any other hotspots that you're looking at or concerned about in the state?
So I looked at the numbers. I don't have them in front of me, but the numbers I looked at an hour ago, Bergen County was over 3 times the next county. So the top counties, far and away, Bergen, in terms of positives, that is.
Mm-hmm,
and by the way, Bergen has had 4 fatalities of the 11. Bergen, and then behind, meaningfully, but still, still significant numbers. I'm going to say somewhere between 50 and 80, Essex, Hudson, Middlesex, Monmouth. And then increasingly, there's been a spike in Ocean. So those are the sort of the top numbers in terms of by county. Less hit in the south, but those numbers are starting to creep up. Salem County, as of a short while ago, was the only county where we didn't have any confirmed, although that could be overtaken at this point by the data.
A question from one of our readers. Daycare centers remain open. Why is that? Because people are worried about the health of their children and the workers.
They're open, although we watch that very carefully. I think we're closing adult daycare, by the way, but for kids, when you shut the school systems, public and private, when you've got so many healthcare workers who are our heroes, by the way, at the point of attack, who also happen to be parents, in some cases, single parents of school kids, we've got to be really careful that we don't tilt the machine completely out of whack here. We need some place for parents to go with their kids. Now, clearly, we got to take this very seriously to make sure that that we keep those places as clean and as disinfected as possible. But we've got to, at least for the time being, we've got to rely on our daycare centers still.
How bad is the shortage of respirators and equipment? What are you doing about that? And what else are you hearing from hospitals?
Yeah, I mean, that's the big challenge right now. So I mentioned on the one hand, it's flattening the curve, social distancing, and we're going to get more aggressive on that. At the other end, there's really 2 challenges other than the day in and day out care for these patients and the extraordinary work our healthcare workers are doing. Number one, we're probably going to be short, almost certainly short of acute care beds. So we've got the Army Corps of Engineers literally in the state since yesterday, working with our health team, state police, and others to try to reopen closed hospitals, reopen closed wings. And then the more persistent challenge, although that's a big one, are the so-called personal protective equipment that you mentioned, Brett. Those are masks, ventilators, N95s, et cetera. We're short. We've got a big so we're doing everything. We're turning every stone over. We've had a consistent ask of the federal government through the White House for this strategic stockpile. We got a fraction of our request last week. We need a lot more. We're buying wherever we can. There's some great corporate stories where folks are donating, which is a phenomenal behavior. The hospital systems themselves are going out on their own, never mind what the Department of Health is doing to try to acquire this equipment. We're turning over every single stone. We're trying to adhere to the CDC guidelines, but the fact of the matter is we don't have enough.
If another question from readers, if a business is not following the rules and they see someone still open that shouldn't be, who should they contact?
Yeah, they should probably, there's a 1-800 number that works for everything, 1-800-222-1222, but they should also text or call 211 or text NJ COVID to 898-211, or to go on NJ.gov/health. Or to go, if it's a pure business, go to the Bureau of Consumer Affairs. But we need everybody, to your point, everybody's got to be compliant here.
Should people still be doing elective surgeries at this time?
I don't think even if they want to do elective surgeries that they're being allowed to. I'll give you a personal story. I had cancer, kidney cancer, and was operated on 2 weeks ago, Wednesday, on March 4th. And I had a checkup with my surgeon 2 days ago, and as opposed to having to go see him, he said, listen, let's just use your wife's iPhone and let me look at it from afar. But the good news is it looks good and I'm recovering. This is a little bit of a faster paced reentry than I was prepared for, but I'm recovering. But he made the following statement, which is kind of took me back, and I had cancer, and it had to be done within a certain amount of months. But he said almost certainly if I were up now for that operation, it would have been deferred.
Just recovering from cancer, what's a daily day like for you these days? Are you seeing your family, or are you guys
sure.
quarantining at all, or what's going on there? What's a daily day like for you?
We're being careful. I mean, we're all at home, and we're being very careful with the amount of new folks that are passing through our house. We basically are shut down. I've been going to work most days. I'm speaking to you from my Newark office right now, but I've got to be careful. And I would just say to everybody out there, I'm getting better by the day, so I'm not worried per se, but anybody whose immune system has been compromised has to be particularly careful. So I'm minding my P's and Q's, as my late father would say, picking my spots where I go to work, trying as best I can to work the phones, do virtual stuff as we're doing right now, and staying home wherever I can.
I'm going to wind down here. If people can't pay their rent or mortgage, people who are worried about that, what is the state doing to help?
I'll tell you, we're passing laws and we're being aggressive about a whole range of things. If your license is due, we just gave you 2 more months. If there's no foreclosures, go the better state right now. We're leaning heavily on the banking system to make sure they give folks every break possible. I want landlords to hear us loud and clear. This is the time to give people a break. We had 15,000 unemployment insurance requests on Monday alone, Brent. This is coming with an enormous economic toll. By the way, we have no choice. So the 2 choices we had was ignore the virus, have an enormous amount of fatalities and people sick, and have an economic cratering, or get out ahead of this, flatten the curve, limit the fatalities of people who are sick, but also still have an economic meltdown. I'm going to take door number 2 every time out. We need the federal government, but I'd say to everybody, hang in there. We're doing everything we can to have your back.
Last question, very Jersey centric. Are you at all considering lifting the ban on people self-serving gas? Like, will that help at all, or is that?
That has not come across my desk, and that is not a consideration, at least at this time. And my guess, at least in this time, probably translates in New Jersey for the rest of time.
And real quick, President Trump gave himself a 10 out of 10 on his response to this. What do you give yourself, or is it to be determined? To be determined. I mean, this is so far. This is like saying how was the baseball game, and we're in the bottom of the first. We have a long way to go in this. I hope it's sooner than later, but I want folks to realize we're going to get through this. Unequivocally, we're going to get through this. Not unscathed, not without mistake. But we will get through this, assuming all 9 million of us do our part, each and every one of us. It won't be, unfortunately, the numbers are going to go up before they go down, and it won't be as fast as we'd like, but we will get through this. Governor, thank you for joining us. Please follow NJ.com in the coming days for more information on how the state is responding to the coronavirus. Thank you again. It's Brent Johnson from NJ Advanced Media. Have a good rest of the day. Thanks, Brent.